Yes, Nivedita, you can start.
Is it visible, everyone?
Please wait for a minute. Huh?
Yes,
Visible.
it's visible.
Nivedita, you are not
Yes, sir.
audible.
Yeah, sir, just a minute.
Please,
Just
take
give me
your
a
time.
yeah.
Take your time.
Yes, sir. Hello.
स्क्रीन शेयर करायची
हाँ, मैंने माझी नहीं शेयर करी.
हाँ
Yeah. Hello. Hello.
हाँ जी you are audible.
Yes, go ahead.
Am I audible?
Yes, you are audible,
Yeah,
madam.
yeah.
You are audible.
So, namaste, namaste all. Thank you so much for giving me this opportunity. And I'm a bit nervous after such a great and wonderful presentation by Santanan sir. And now it's night, so okay. So 33 years old female approached me, and her complaints were like, she mentioned that she had a stealing habit, and she has a lot of interpersonal issues. So, and the onset, I took history. So onset was when she was 15 years old, and she mentioned that she had seen her father doing this, and from there she learned it. About the mother, what she explained and what I have understood, that mother was going through depressive symptoms. Before marriage, it started when she was 15, 16. And then after she got married, it was a love marriage. And after she got married early, I mean 20 May, and then she went to US. And in US, the scenario was very different. Like, it was very easy for her because she mentioned how she used to do. Like, she told me that she used to change the label. So just say if the commodity is of say 10 rupees, she will change it and put it on the 20 rupees costing object. So like that she used to do. Plus stealing was there. And the benefit, she said, that in US, like, they don't make any police complaint, even if the person is caught doing this thing in malls. So her area was, she mentioned, that DMart and malls, because so she used to do that, and it was easy. Because they're like, they don't make police case, they just give you whatever you have taken back, and they take money from you and give you the commodity back. So that was very simple. So it was easy for her. So she continued with this thing, and slowly and gradually, because she was in US, so they have that groups like Svadhyay group, yoga group, and then friend circles and all that. So slowly and gradually, she started doing this with friends, relatives, and the gym, at gym also, and the Swadhyay, with Swadhyay people also. And they were very supportive. So things were taking different shape, but they were very supportive. So they talked to her husband and explained him that this is something mental disorder, and you need to take professional help and all that. So after that, they came back to India, and he was very supportive. Husband was very supportive. So after coming to India, Nidhi, please change the slide. Yeah. So then she started coming to me for sessions, and the findings were definitely kleptomania, interpersonal issues, GAD, OCD symptoms, aggression and retaliation, impulsiveness, and suspicious behavior. Nidhi, please change the slide. So then we started counseling and psychotherapy, and it took long, almost 20 sessions, but she used to come late for the session. Many times she used to leave the session half of the week, or she used to postpone or cancel the session last moment. So it took actually too long, and there were many things like it was not in flow the way it should be. But then okay, and then we did work, and she did overcome the habit up to a great extent. And she felt that she is done with that, and she abruptly stopped taking sessions. So there was no concluding session, nothing. So she just stopped. So Nidhi, please change the slide. So then it stopped there. And then during COVID in 2020, the precipitating factors were like, in COVID, she lost her mother. And before she lost her mother, there were many issues and quarrels in the family related to mother's treatment and mother's property. So she was going through a lot of stress, and she approached in 2020. Her complaints were I'm going through a lot of differences in the family, so interpersonal issues were there, and disturbed sleep and anger issue. And she said that I want to work on this area. So I didn't touch deliberately. I didn't ask her about it. I just started with counseling. And after a few sessions, we did breathing awareness, and then after few days we again did PMR, neutral, and then neutral transit. Maybe please change the slide. In session, just slide changed. So she complained all these things, and we started with this thing. Then after doing this PMR and neutral trans breathing awareness, after a few days, she mentioned that I am having again those thoughts, all those thoughts, stealing habit, and all my stealing thoughts are coming back to me, and I'm scared that I may get into that again, and I don't want to get into that again. I'm very scared, and I feel guilty about it. And she also mentioned that she said that I went 4 times, I left home with the same intention. I opened the locker, I opened the purse, I opened the Elmira, but I didn't take anything. This is what she mentioned. So I said, okay. And then the predisposing factors here, like behind, feeling that and stealing and all that. So the factors were that she said that whenever I spend money, I feel that I have lost my money. So, and I want my money back. I don't earn, I don't work, I don't earn. I want to save my money, and I want to do my future, expenses. And so I want my money back. But because I don't work, this is the only option I feel, and I do that. So Nidhi, please change this slide. She also, along with this, she also mentioned that, I get irritated. I get impulsive when people criticize me, because her family members, they knew about it, and there were differences and quarrel and all that. So yes, they have mentioned that you're like this, and particular things also they used to mention, and she used to get irritated. So she and angry also. Apart from that, she said that we are planning to move to US. So I'm very afraid that what if I will come across the people who know about my habit, and जिनकी चीजें मैंने ली है, तो what I will do, how I will manage the things and all that. She also mentioned that I just can't forgive myself, but I can't help it. I feel guilty about it. So, Nidhi, please change this. So, my plan of action, I divided the whole thing into two major areas. Like, first, to change the behavior. I planned SIC, and to manage the emotions and thought and getting irritated and fear and guilt, forgiving self. For that, we planned dynamic imagery. And ego purification, I gave her on alternate basis later on. So I just conducted one CBT session where we did reconstruction of thoughts, and then we started with SIC. Maybe I think you need to change the slide. So in SIC, we started with breathing awareness, and induction technique was eye fixation and mind distraction, and then PMR. And then we started after that old movie, old CD, then with a new CD, that your behavior is, you're behaving decently. You are in a balanced state of mind, and you know what is right now, you know what is right and wrong, and your every decision is socially and legally accepted. You have developed patience, and now you have control on your every action and every move, and you dominate your urges and your temptation. Now you are very steady and calm, peaceful, and you're a composed person. And now you are aware, and you realize that you have everything at home, and you don't need anything in excess, and you have that capacity. If you want, you have capacity to purchase those things. So I'm sorry, you just have to pay for that, and in return, whatever you are getting, the commodity, whatever object, whatever service you are getting, that is a satisfaction and happiness you get in place of your money. So that is the exchange. After that, one more thing we discussed during the session, I told her, like, you can control your expenses. Gratification, delaying gratification was also given, that suggestion was also given. And yes, you have those capacities now, you have those potentials to earn the money, put the efforts and earn the money, because you have that caliber. And now you are in a you are able to implement all the social value, all the values, the value system, like honesty, sincerity, truthfulness, and everything, and you can implement. You are in a condition, you are able to do that, and so you are very happy, you feel good about yourself, and you feel peaceful and contented. Post-hypnotic suggestions were like, yes, you have created internal reality, which will be external reality gradually and naturally. And even in your normal waking state of consciousness, while facing the situation, you will have desirable and positive thoughts and feelings, and that will, that will change your actions, appropriate, and that will result into appropriate actions. So this, then the trance was terminated, and then I asked her. The feedback was yes. She said, I feel calm, quiet, peaceful, and little confident also. Then after practice of say 21 days, when she came back, we start for the another session. She mentioned that I had a thought. I wanted lipsticks, so I was planning to steal lipsticks. But this time she said, I went to market and I bought 2 lipsticks. Reason is because if I lose one thing, I will have another one, and I will not even think about stealing it. So that was the feedback, and I think it was quite satisfactory thing we were moving with. So maybe please change the slide.
Ma'am,
Sorry.
ma'am, I think this is the last one. This is the last slide.
Yeah, it is the last time. In your this thing? Okay,
The last.
it must be there. Okay. Then for managing managing the criticism and her emotions and her fear particularly and about forgiving self, I did one CBT and reconstruction. We did restructuring of the thoughts, and after that we practiced dynamic imagery. So after doing dynamic imagery, after finishing immediately after finishing this session immediately, her feedback was, she said, I have realized that I was living in a cocoon. And now I think why I was bothering about all these things, why I was getting into all the mess. क्योंकि कहीं भी कुछ भी थोड़ा सा होता था तो she used to get triggered. Kahin jealousy, kahin gussa, so something like that, anger, jealousy, and she used to get triggered and things, she used to feel impatient and all that. So she said that I have realized that I am making this mess, otherwise it is all fine. And she also mentioned that, she said, today I think and I feel that, she didn't use the word inferior, but then yes, I feel inferior than my husband and all my friends, because I cannot earn. I'm not qualified as my husband is. I don't work. I don't earn. I can't speak English, and I'm not confident. So I don't have good qualities, she said. So that was the feedback I received from her. And then, as I mentioned, that positive SIC CD was given for the practice, then dynamic imagery, and then ego purification separately I gave her. And that's it. So thank you. So can you give me your feedback?
Thank you. Thank you for the presentation. So now the topic is open for discussion.
Sorry, sir. Just a minute. Voice.
Ma'am, may I ask you a question, please?
Hello.
Hello, ma'am. Am I audible?
Hello.
Hello, ma'am. Am I audible or am I visible?
Yes.
Audible, visible, both.
Yes.
Just wanted to know the reason, ma'am, that this is the first case I have seen of this kind. Thanks for enhancing my education.
Sorry, but maybe could you please repeat the question?
Ma'am, thanks for enhancing me about kleptomania. The only question which I wanted to know is that how far can it have roots embedded in your childhood?
Sir, actually, I'm not able to listen to you properly. I'm not able to listen to
Can you hear me?
Yes.
Are you able to hear my
Yes.
voice?
Yes.
So,
I can hear you.
the question that Razi sir is asking is that this is for the first time he has come across a case of kleptomania, and could there be a possibility that the reason of this behavior developing was because of the past experiences? Am I correct, sir? This is what you want to know?
Childhood to be more precise.
How did the childhood experience contribute to this condition? I think that is what he wants to understand.
Yes, sir. As she mentioned that she had seen her father doing that. That was one reason, and definitely then the inferiority she had. So these two reasons, I think, were playing a major role, and there were other factors also, because she is not learning. She is the youngest in 4 siblings. So she was like, हमेशा छोटी है करके इतना importance घर में उसको सुनने में नहीं आया था. So environmental factors भी बहुत थे, and they were from the lower middle class family. Now the thing is different, but then yes, that time it was like that. So there were urges, I want that, I want this, I could not buy, and it was there earlier also. And as such, there were four daughters, 4 siblings.
Maybe an unwanted child.
Maybe
you have explored the history properly about the sibling history, then it would have been engraved in her mind, and there must have been a very, very severe deprivation of the resources, and
Yes.
As a result, she would have developed it as a kind of, survival mechanism.
Yes, yes,
And
yes,
so
that
these
could be.
urges, they are very strong when it is engraved in the early childhood as a survival instinctual behavior. Then they are difficult to overcome. It requires a lot of effort. I won't say difficult. It requires a lot of effort to overcome them individually, as well as for a therapist also it's a challenge.
Yes.
Most of the time she disconnected, you mentioned, so might be that she wanted to preserve with the symptom.
Yes, sir.
She is feeling some kind of satisfaction.
Yes, you're right,
Keeping
sir.
this symptom. Yeah.
Yeah,
So
and she,
they don't follow you. They want to avoid you. They want to, because then with the symptom is gone, the pleasure derived out of it is gone.
yes, yes,
So that could be the thing.
yes.
And yes, but this was anybody else is asking, then I will
Yeah.
tell about myself.
No problem, sir. No problem.
Hello, Nivedita.
Hi,
Yeah.
Nitin.
Sorry.
I'm
Yes, Nita.
sorry. It was a wonderful thing. I think the journey must have been really, really lengthy than what you are
Yes.
trying to cover it in few
Yes,
minutes.
actually.
And kleptomaniac is something that even I haven't worked on till today. I'll be very honest with you. So we learned a lot of things out here. I just wanted to ask you that which I mean, of course, it's altogether integration of a lot of things that you've done, but which technique or which thing you really felt worked with her more or gave her more effect? I would like to know that. Thank you.
Yes, 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 sure. So, see, as I mentioned that when she came to me for the second time, that time we already finished with our breathing awareness practice, PMR practice, and neutral trance practice. And in between, I did check with that phenomena. So, this practice she was doing, and she was quite okay with that. And then I directly started with SIC because it was the behavior aspect, we wanted to change the behavior. So SIC helped her. To be very honest and to be very clear about it, SIC did help her.
Okay.
Yeah, and
Okay.
after that, as I mentioned, that criticism and her own fear and whatever she was feeling, that how I will manage when I will go to US, how I will face those people, and I get angry when people talk about me, because people are going to talk, those who know, at least they will whisper, and relatives, particularly the younger ones, whenever she used to have fights at home, they used to bluntly, tell her on face. So definitely that was very, very disappointing to her. But then, yes, so wahan par butterfly imagery, dynamic imagery worked very well, because then I explained her, you're free. Now you had that habit. Now you have overcome. And people will talk because they know the old Pinky. They don't know the new one. Right. You know that now you are a balanced person and all that. So you have to give little time to them, and that is how you will able to control your emotions also. Have I answered you?
Thank you. Yes, thank you very much. Thank you.
Thank you.
Here, while you were talking, I was thinking of one or two things.
Yes, sir.
That, you could have gone for exploring it in the childhood. So age regression, if it is able to reveal something, and then the ego state therapy, that you are evolving out of it, and you have eliminated that person, you have dissociated, and that is what her future anxiety, that if I'll go to US, whether I'll be able to control all.
Yes.
You have to give that, you are dissociated and you have evolved out of it.
Yes, sir, you're right. But I was not very confident with, past life regression and
not past life, age regression.
Age regression also. I mean both. Yes, sir. I mean both. I was not very confident.
Yeah, and personally, I am not very experienced with past life regression, but age regression is okay.
And that time my concern was, because I want to, we are working on the behavior part, let us go with SIC. And
Perfect,
of course, to be
perfect.
very honest, I was not confident about both the
Perfect.
therapies.
This is for the future.
Yes, sir.
When we set things, you can
Yes,
explore
sir.
that. Yeah.
Yes, sir. Thank you so
Thank
much,
you.
sir.
Thank you. Thank you.
Yes, sir.
Nivedita, it was very nicely handled.
Thank you, sir.
I sense that you used the right approach and technique at the right time during the progress of the patient.
Thank you, sir.
I just wanted to know
Yes, sir.
how much longer is the follow-up now? When you
Yes.
did last session?
Yes, sir. Yes, sir. So, sir, last session I did say 8 to 9 months back.
Okay. And
I talked to her day before yesterday.
Okay.
Because I was present. And in between, yes, her husband is in touch with me. Yes, sir. Now they are in US.
Okay. And
Yes,
you
sir.
talked to her recently and found that she's fine.
Yes, sir. She told me precisely day before yesterday that I have not done anything after that, and I'm very happy about it, she said.
Great.
And she also mentioned that even if I have a single thought about it, I'm able to manage.
Wonderful.
Yes,
That's
sir.
very good.
Yes, sir.
I appreciate it.
Thank you, sir. Thank you. It is just because of your teaching I could do this, sir. Thank you so much, sir. I'm really happy that I met you on the journey of my life. Thank you, sir. Thank you so much.
Continue working and helping people. Huh?
Thank you,
Very
sir.
good.
Thank you, sir.
Yes, Prashanta.
It was an excellent, both the case presentations are very good, and the details of the therapeutic process have been nicely explained. It's a very challenging to deal a case with kleptomania. It is one of the most difficult cases among the impulse control disorders. And the sensory integration approach is being quite helpful for all the impulse control diseases. So it is
Yes,
rightly
sir.
chosen therapeutic
Right.
approach. Yes, if you want to go for more hypnodynamic work, then what Dr. Abneesh was suggesting,
Yeah.
that could have been helpful. But yes, we have seen that with some of the cases, many of the cases of these impulse control disorders, without the hypnodynamic work also, they do better for longer period of time, though there might be some occasional lapses.
Yes.
So some of the self-hypnosis techniques, or maybe ego strengthening techniques, if they continue, so that the lapses can be less.
Yes.
So I'm having one suggestion
Yes, sir.
about this particular case.
Yes, sir.
Even the cognitive behavior therapy in kleptomania is not that much prominent. We don't get many case reports. So
Yeah.
when we are getting a good outcome out of hypnotherapy, and this kind of cases, the initial, the diabetic neurosis, we might not, when we are going for publication for it, we might not use the diabetic neurosis term because scientific forum might not accept that. And the kleptomania case, both cases should be considered for publications in a proper manner. Sir used DASS 21. I'm sure that probably later on also he has used the same tool. If it is not now, if that particular tool also can be administered, so that we can get pre and post data, because all the publication house, they need a quantified data. Okay, here also in your case, we don't have any scale to assess kleptomania, but if we use the behavioral frequency, how much the frequency of kleptomanic behavior at the baseline, maybe for 3 months,
Yes.
then how much it is. So if this frequency you can get, probably that also can give us an indication of outcome.
Right,
So
right.
these are some of the suggestions that I would recommend.
Yes.
Another suggestion to sir, that instead of ending at the 10th session because there was symptom recovery, better to keep 1 or 2 booster sessions maybe every 3 months, so that we can reinforce the practice. So that is the only suggestion that I will have. And here also I'll suggest the same, some booster sessions may be helpful. Thank you.
Yes, sir, definitely. Yes, sir.
Very good suggestion, Prashanta, that some follow-up sessions at regular interval is necessary. Not only these cases, but in almost all the clients with whom we work. And that's how I started meeting all the people who took treatment in the form of that Samatvam monthly meeting. Their monthly meeting where many clients come, those who took my treatment before 10 years, before 15 years, they also come and meet monthly. Nowadays, we meet on Zoom. And we find that it's very necessary